I'd like to welcome everybody out to the direct introduction for San Diego Health Connect. Today we're just going to talk a little bit about direct, what it is, how it works, and then talk a little bit about what it can be used for. So direct messaging is a standard that's called out in the meaningful use requirements, and specifically the transition of care measure. And in the transition of care measure, it says that 10% of transitions of care from one organization to another have to be sent using the direct protocol. The direct protocol is based off of SMTP, so most people refer to it as a secure email. And that's basically how it functions, is a secure email with certificates in the back end that encrypt the messages and decrypt the messages. And probably the best way to understand it is if we showed it to you. So San Diego Health Connect has a direct HISP solution that they provide to participants in the community. One way to access this system is through our web portal. Logging in, a user will log in with their email address, which would be their full email address. And then they are sent an automatically generated password. That automatically generated password will have to be changed after the first login, and then the user can log in using whatever password they've set up. Depending on the user's access rights, they have different buttons that will display. The main button that we're going to be talking about today is the direct email button here. And by clicking on this direct email button, it's going to launch me into the direct email application. So if I click on that right here, it's going to open it up, and if anybody's worked with a webmail-based system, so for example, Gmail, Yahoo, this will look pretty familiar because it is kind of like a web-based system, webmail system. But the important part behind direct is that these direct messages are encrypted, so PHI can be included in these direct messages. And the payload for these direct messages is what's called a CCDA, sometimes referred to as a CCD as well. And this is a document that has discrete data in it, discrete data elements, and discrete information that can be used to view information on a patient. An important part of direct, because it is encrypted and it is secured around certificates, is that from this webmail application, I can't send out to any email application. For example, I can't send to my Gmail account from here because my Gmail account is not a secure application, not a secure recipient. So I can only send to other secure recipients. What we've been doing with Sharp, we've been actually doing some testing, and I have an example here of the transition of care document that they received. So as you can see, it's received similar to an email, but then there are these attachments. So there's a transition of care document as well as a style sheet that can be applied to that transition of care document. And then let me go ahead and pull up what that document actually looks like so that people can see it and see what information will be included. So this is the transition of care referral summary that was sent out from Sharp to our test mailbox, and this is a test patient. It has basic demographic information on the patient, their name, sex, date of birth, whatnot. Since it's applied with a style sheet, you can actually jump around into the different sections. So for example, if I wanted to see the medications that were given during this visit, I could jump to the medication section and view those medications. And then if I jump to the assessment plan, I can read what the assessment plan was. And if I jump to the hospital discharge instructions, I can see what the discharge instructions were. So that's the actual document that can be sent out and that is able to be received by the recipient on their end. Another important part to direct is provider directory, and San Diego Health Connect also offers a provider directory solution. And what I mean by provider directory is now that we have these accounts, you need to know who to send to and where to send to. So I'm going to just show that really quick. By clicking on the provider directory link in the top, you can be directed to the provider directory. The provider directory has the ability to have relationships in it. So for example, if I just search for Sharp, I'm going to get a couple different results. the Sharp Hospitals, and then Sharp Healthcare. So Sharp Healthcare is the overarching organization that could possibly have its own direct address, but then there can be associated organizations and participants or individuals. So for example, with an associated organization, if I click on this, I can see that there are 4 organizations that are associated with Sharp Healthcare. There's Sharp Chula Vista, Sharp Coronado, Sharp Grossmont, and Sharp Memorial, and they each have their own direct addresses. And then I can also see that each organization actually has an individual that could be associated with it, or multiple individuals. So for example, Sharp Memorial has one associated participant or one associated individual, which is a clinician. So if I click on this, it will actually take me to see those clinicians, and then I can go in and find that clinician. And if the clinician does have his own direct address, then I can find that here and use that to send to. What's important about this too is that individuals can be associated with multiple organizations. So for example, this individual is associated with Sharp Memorial, but this individual is also associated with Scripps Mercy San Diego. So the provider directory adds a lot of value as well, so that you can know where to send these messages and who to send them to. So that is actually the demonstration in its fullness. So I'm going to open it